We're back with day 2 of the nurse strike in New York City. Thousands of nurses walked out of 2 major hospitals saying low pay, long hours, and minimal staffing are causing many of them to feel burned out.
Many say patient care is also at risk because of the conditions they're forced to work in.
NBC News correspondent Vaughn Hillyard joins us now from outside Mount Sinai Hospital in New York City with the very latest on all this. Vaughn, good morning to you. So we're now in day 2 of the strike. Remind us, why are these two sides at an impasse, and what are you hearing from nurses right there on the front lines of this strike?
Yeah, good morning, guys. We're now at 24 hours in which this impasse is taking place. Negotiations continue not only here at this Upper East Side of Manhattan hospital, but also as well as a hospital in the Bronx. We're talking about nearly 7,000 nurses who are now on strike here. Resources have had to been shifted to these facilities from public and private agencies as they try to make up for the absence of these nurses inside of these hospitals. But I want to let you hear from Amanda Smith. She is one of those nurses here who I met yesterday evening who is on the front lines of this picket. Take a listen to part of our conversation.
We're here for our patients. You know, they say safe staffing saves lives, and the nurses working at Mount Sinai are working under bad patient to staff ratios, so we're here for better staffing conditions.
In just about an hour ago, the Nurses Association here in New York City tweeted, "Can't stop, won't stop until we get a fair contract." The nurses who we've had conversations with over the last 24 hours insist this is more than compensation, but this is about the staffing shortages inside. And you heard Amanda note there that the ratio of patients to nurses is too high and that they need backup. Guys?
So, Vaughn, with over 7,000 nurses on strike and both hospitals full of patients without care, how is the State Department of Health handling the lack of nurses inside these hospitals?
Right. That's what the New York City Mayor Eric Adams said yesterday, that they were making sure that these hospitals were addressing the staffing shortages, turning to public and private agencies to bring in, for instance, traveling nurses here. But also they have canceled elective surgeries at these 2 facilities. They have also directed ambulances away from these 2 medical centers. You know, we heard from a new mother yesterday with the child who's in PICU, and they had to actually take the mother and the child to a different hospital facility. But I want to let you just look at a part of a statement here from the New York Department of Health here, in which they say, quote, "The department has deployed surveyors to the affected hospitals to ensure adequate health care resources are maintained to meet the needs of the community, to review and enforce required minimum staffing levels here." The attention here from not only the city, but there's also attention from the state here in the heart of New York City.
Yeah, let's talk about the state. We know Governor Hochul called on the nurses to go to arbitration. How did the Nurses Association respond to that request from the governor?
Right. The night before this strike went into effect, Joe, it was Governor Kathy Hochul who called on the 2 sides to meet in binding arbitration, essentially having these 2 sides work out a deal with an arbiter. But ultimately, it was the Nurses Association that declined that offer, and you heard from the hospitals that pushed back against the Nurses Association, saying that they've left a good, not only a good deal, a good fair contract on the table, but now are also declining this binding arbitration that the governor put forward here. That is really leaving to questions as to what the Nurses Association wants here from the hospital. The Mount Sinai Hospital here yesterday put out a statement saying that the deal that the Nurses Association has in front of them is a good one, and that they are the ones that are leaving their patients out in the cold and in need. These are tough negotiations that have real life impacts, but the nurses insist that they're doing it to ensure that there's better long-term care for those very patients.
All right,
guys.
Vaughn Hillyard here in New York.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.